Hello, my name is Dr. Jenica Paz, and I am an assistant professor at San Diego State University. I, along with my colleagues, Drs. Carol Robinson Zanyartu and Patricia Sanchez Lazardi, are delighted to be able to share some of our work with you at this year's 2021 OSEP Directors Conference. Specifically, the title of this poster presentation is Evaluating PUEDE's Community of Practice, Advancing Collaboration. We know that the U.S. Department of Education advocates for and now mandates that concurrent preparation across professions as an important feature of personnel preparation grants. And although some aspects of successful collaboration are known, many are not, especially those that contribute to long-term effectiveness. Identified barriers to effective interdisciplinary work include misunderstandings of each other's roles and capabilities, challenges in developing parity, relinquishing control, sharing expertise, and in authentic communication between professions. Collaborators tend to remain siloed with artificial boundaries once in practice. Thus, defining and evaluating effective collaborations not only adds power to the projects themselves, but to our knowledge base going forward. In this presentation, we will demonstrate the design and evaluation of the community of practice that underlies the collaboration on the PUEDE project. The PUEDE project supports the concurrent preparation of bilingual school psychologists and bilingual speech and language pathologists to specialize in interprofessional collaboration and to develop collective knowledge of cognitive, social emotional, linguistic, assessment, and intervention for dual language learners presenting with high needs and challenges. The Communities of Practice framework is a conceptual model that underlies the concurrent preparation of bilingual school psychologists and speech and language pathologists. In the Communities of Practice model, deep learning occurs in social contexts in which people have common goals and a shared identity emerges through engaging in and contributing to the practices of their communities. In Project PUEDE, the Communities of Practice model provides for an interprofessional collaboration between school psychology and speech and language pathology perspectives. A three-part structure organizes the Communities of Practice model, and those areas include mutual engagement, joint enterprise, and shared repertoire. This model provides for integration, collaboration, and alignment across diverse professional perspectives. Our goal in developing an evaluation of our community of practice was to capture not only the concurrent experiences of the scholars, but also that of our graduates and constituents. Thus, our aim was to examine both short-term and long-term outcomes. Our initial survey evaluation instrument was developed by closely following the guidelines and suggestions provided by scholars Wegner, Trainer, and Delat from 2011. And this was designed to promote and assess value creation in communities and networks. The first cohort of PUEDE scholars completed the instrument, and although some encouraging and informative information emerged from that initial pilot survey, scholars indicated that some of the questions were confusing or unclear to them. Thus, we reviewed and redesigned the survey to align more closely with our project goals and conducted a readability and reliability analysis to help the questions and formatting be more accessible to our scholars and constituents. In the readability study, our survey was distributed to approximately 14 different key constituents, which were made up of other OSEP project directors from other training programs, alumni, community constituents, and community partners who were familiar with our work. The intention was to help diversify the ratings, contributing to inter-rater reliability among items on the newly revised Communities of Practice survey, and help inform the generalizability of findings across other interdisciplinary training projects. Comments and suggestions from the readability study were used to finalize and redesign our survey. And then with that redesigned survey, we piloted the new survey and administered this to this year's PUEDE scholar cohort in order to obtain more accurate and clear information regarding the components of communities of practice that underlie our own PUEDE project and community. Overall, the revised survey retained 21 survey items, which include both Likert and narrative format. They were organized conceptually by 5 important domains related to communities of practice, and this includes mutual engagement, joint enterprise, shared repertoire, performance enhancement, and reframing value. Overall, results from the readability study indicated good to excellent inter-rater reliability for use of the communities of practice survey. And as we noted, we obtained several layers of feedback from 14 different project constituents and alumni. So we made many refinements to the survey to enhance the readability and accessibility. So on top of the excellent inter-rater reliability, we also have face validity from folks that are familiar with training programs, so their feedback was invaluable in order to help shape this revised communities of practice survey. Results from this spring 2001 cohort from Project PUEDE, from their responses on the revised COP survey, reflected overall very high mean scores in the domains of mutual engagement, which consists of items related to their quality of participation, quality of collaboration and engagement as being fun and inspiring, and of personal and professional relevance. Mentorship and trust were noted to be essential. In the joint enterprise domain, joint enterprise refers to how participation in PUEDE changed or influenced their view of learning. The scholars reflected themes related to thinking much more deeply about case conceptualization, having increased confidence, expanded professional relationships with other educators, a sense of community, and a view of learning as collaborative. It should be noted that throughout Project PUEDE, there was a very intentional and deliberate attention set on developing collaboration and communication. Specifically, my colleague Carol Robinson-Zanyartu created collaboration rubrics, which were a semi-structured tool that were utilized monthly as a guiding tool to help scholars intentionally get to know one another and on a much more personal level, which really helped them develop and foster trust. So having this deliberate attention to collaboration in a structured way really helped facilitate deep conversation as a way to really dive into what effective collaboration is. So there was a key element of intentionality in this guided way that my brilliant colleague, Carol Robinson-Zanyartu, was able to masterfully integrate within this Project PUEDE to really help build this sense of community and collaboration amongst our scholars. Next, in the area of shared repertoire, scholars reflected on how they gain new skills to support high needs dual language learners using a variety of tools such as pre-referral strategies, assessment, consultation, and social emotional learning strategies. With respect to performance enhancement or the realized value domain, which includes the effect of participation in PUEDE on what really matters in their professional life, achievements based on participation in the PUEDE community, scholars reflected that PUEDE members are very well respected in schools and in the community. They represent an important voice. They have a reputation of initiating change and helping those from diverse backgrounds. And they even reflected and commented that they are seen as revolutionaries within the community. With respect to reframing value or redefining success, this refers to how experience with PUEDE changed their understanding of what really matters, or influenced or changed anyone else's understanding of what matters. New understandings translated into a level of policy change or new procedures. Our scholars noted that they are able to have much deeper conversations about bilingualism with peers outside of PUEDE, and this has shaped how they practice as well. So in the future, we hope that others may be able to generalize the use of the COP survey to other OSEP training grants that are interested in better understanding their own community of practice in depth. We hope that you enjoyed learning a little bit more about our own community of practice and enjoy the rest of the OSEP Directors Conference. Take good care.